The eHealth Productivity and Innovation in Cornwall in the Isles of Scilly project, EPIC for short, ran 8 workshops across Cornwall in September 2017. The workshops attracted nearly 300 participants, including patients, carers, health and social care professionals, managers, students and business representatives. The workshops were informal with plenty of time for lively discussions and networking over lunch, helping to make connections and encouraging debate about how technology could be used in health and social care is an important part of the project. Participants got to experience a range of technologies such as therapeutic robots, apps, smart speakers, virtual reality, and many people also had their first interaction with a humanoid robot. After a brief introduction to the project and the workshop's aims and objectives, we broke into groups to discuss the challenges in health and social care and the potential technology solutions. There were a lot of creative suggestions. Whilst the project will be considering how to take all of these ideas forward, some participants kindly agreed to share their thoughts to give a flavour of the discussion and the opportunities.
I've come today because it was really interesting and exciting, the sort of technology that's being implemented into the workplace and also helping with the environment of social care. The opportunities for engaging with drone technology, virtual reality, it's just absolutely fascinating.
We don't have a local doctor's surgery in our village, and a lot of the elderly people, particularly that can't drive any longer, have to get on a bus and travel to nearby towns or villages to get to their GPs. They're used to going to our local Methodist chapel to access post office services, mobile library services, so why can't there be a mobile GP's practice where that system's held, that they could log in and speak to their GPs or practice nurse in the same way?
But often one of the things I find is that patients haven't got any access to either local facilities to continue with their exercises or to be able to have some support and motivation. And I personally feel that current IT technology could be a huge component of that, either through video playback, supportive phone calls on Skype or something similar, and also a way that they can monitor their progress and that I can as well.
Probably the key challenge is workload. We've got an ever-increasing demand for our services, whether they be doctors, nurses, phone calls, receptionists, and we don't really have the resources to match that. So our staff are having to work harder and harder and harder, and it's becoming more difficult to access the services. So I'd say really workload is the main challenge for us.
So we have an issue that are coming up where we're having an ageing population, a increasingly dispersed population with the actual health services themselves in those rural areas contracting. So the distance between an individual and their healthcare will be becoming greater.
So the key issue for us, certainly within our service and within Cornwall Foundation Trust, is to look at how we might be able to develop the self-management approach for patients with long-term conditions. There seems to be a lot of gaps in the knowledge and the advice and the way forward for these patients.
But for me, a lot of it is around independence. So being able to go into a supermarket and purchase my own shopping, that would be really remarkable. So if there was some kind of system, maybe an electronic card or something that interacts with the shelves almost, so it can tell you if you've got with the baked beans or the pasta, but it could make a huge difference and create more independence.
Currently we employ a full-time activities coordinator, but because most of our residents either have a hearing loss or a sight loss or a short-term memory loss, she has to spend an awful lot of time one-to-one. We're very keen on Pepper, the robot. We think there might be something there.
When our residents become acutely ill, sometimes the only option is for them to go into hospital. I'd like an IT solution that could actually connect us with the hospital so that we can actually manage their acute episode in our care home.
So my real interest here is in finding technologies that can help people to manage their own mental health and well-being. And that might be as simple as an interactive application, an app that maybe helps them through certain processes but might help them through certain experiences as well, for example, relaxation. But today I've also seen some virtual reality solutions that might help to deepen those experiences where that's relevant.
So using an app that actually you can feed in your kind of health data or your lifestyle data, which then you can see how the picture of what you're going to look like or your child's going to look like changes.
Our group today talked about developing an app to improve communication to enable patients to access aspects of the records very easily and to make requests for appointments or book appointments or otherwise access healthcare through the app and through their phone, much as in the way people routinely access their banks through an app on their smartphone.
This was just a small flavour of the very positive conversations held in the 8 workshops. The next stage of the project is to seek technology solutions for the problems identified, importantly keeping the participants involved in the design, development and implementation of technology and supporting Cornish businesses in the development of new e-health products and services using the project's £600,000 challenge fund. The EPIC team would like to thank everyone who took part for their positivity, creativity and enthusiasm. We had a great time meeting you all.